Now guys, after completing the common peroneal nerve and tibial nerve, now the next nerve in the line of major nerves in the lower limb is femoral nerve. So let us learn the femoral nerve and the concepts related with that one. Now to begin with, in any nerve that you learn, the first thing to write down is the origin. And I hope my students are like expert in the origin of all the nerves. We have discussed that in detail in the lumbosacral plexus itself. So try to recall, femoral nerve is the one which is going to originate from the posterior division of L2, L3 and L4. That's done. Now after writing the origin, the next thing to write down in any nerve will be the supply. Femoral nerve will be supplying to which muscle? And we also know this one, it will be supplying to all the muscles present in the anterior compartment of thigh. It will be supplying to all the muscles present in the anterior compartment of the thigh, femoral nerve. Now, if you observe on the screen there, we already know the origin, we already know the compartment. The only thing that we have to learn additionally right now is what are the muscles which are present in the anterior compartment of the thigh. Now, in the anterior compartment of the thigh, number one, you'll be actually having sartorius muscle. There will be sartorius muscle, and number two, there will be a quadriceps femoris muscle. Quadriceps femoris muscle. Let us discuss all the important points regarding these two muscles first of all. Sartorius muscle and the quadriceps femoris muscle, guys. Now, out of these two muscles, first of all, let's study about the sartorius. Remember, first the another name of the sartorius muscle. Sartorius muscle is also referred to as Taylor's muscle, and one more name, remember, it is also known as the honeymoon muscles. So, sartorius muscle, it is also known as the Taylor's muscle, also known as the honeymoon muscle, and it is actually the longest muscle in our body. Please be very careful with the word there. I am not telling largest, it is actually the longest. Longest lengthwise. Largest and smallest will be size wise. So, sartorius is actually the longest muscle in our body. I'll even show you the picture here so that it becomes more evident for you people. Now, in this diagram, you're able to see here, this is ASIS, anterior superior iliac spine. So, that ilium bone will be actually having like two spines, one is anterior superior, another one is anterior inferior. So, this one is anterior superior iliac spine. And from there, you can see the muscle which is actually cut here, this is sartorius muscle here. And this sartorius muscle is going down here all the way up to tibia here, sir. So, you can see that long one, the length of that, spanning all the way from the anterior superior iliac spine, then crossing the hip joint, then the thigh, and then the knee joint, and then finally up to tibia. That is the reason why it is the longest muscle in our body. Apart from sartorius, you are able to see one more big muscle over here, and this one will be the quadriceps femoris muscle, guys. Quadriceps femoris. Now try to recall in your mind, whenever you come across the word as biceps, there will be two heads. Triceps, there will be like three heads. Quadriceps, it will be actually having like four heads. There will be four heads of quadriceps femoris. Now to understand or to see the names of all these four heads of the quadriceps femoris, let us just take a section here. I am going to take a transverse section across that quadriceps femoris muscle, and the diagram will be like on the other side. If you take a section of the quadriceps femoris, the diagram will be like on the other side. Now on the other side here, first I am able to appreciate one head here, vastus lateralis, and then this one over here will be the vastus medialis, and in between the vastus lateralis and medialis, you will be able to appreciate that there will be vastus intermedius. Vastus intermedius. And then right in the front here, there will be one more muscle, and that is your rectus femoris muscle, guys. So vastus lateralis, vastus medialis, vastus intermedius, and in the front you will be able to see the rectus femoris muscle. And all this will be the four heads of quadriceps femoris muscle. So let us just register all these four names over here, guys. So quadriceps femoris will be having vastus lateralis, and then there will be vastus intermedius in the middle, and then there will be vastus medialis, and then one more along with this one will be the rectus femoris. So all these are the four heads of quadriceps femoris, guys. The name itself is telling quadriceps femoris muscle. There are four heads of that. Then apart from these two muscles, number three, femoral nerve is also supplying to one more muscle, that is pectineus muscle. But the important thing to make a note here, it is not supplying to entire pectineus muscle. It will be just supplying to the lateral half of that one. So femoral nerve will be supplying to lateral half of pectineus muscle, guys. And what about the medial half of the pectineus? Obviously, on the medial side, the medial compartment of the thigh, and that will be taken care by obturator nerve. So without any doubt, the lateral half is supplied by femoral nerve. Without any doubt, remember, the medial half has to be supplied by the obturator nerve only. And that again bring back to that concept in our mind of composite muscle or hybrid muscle. So even pectineus is also one more example of a composite muscle, and hope you all are making a list of all the composite muscles. Perfectly done. Now all these are the muscles which are supplied by or taken care by the femoral nerve in the anterior compartment of thigh. But remember, apart from all these muscles, femoral nerve is supplying to one more muscle, that is iliacus muscle also. But that iliacus muscle is not supplied in the anterior compartment of the thigh, remember, in the iliac fossa itself. That's the reason why I am not mentioning over here, guys. You can write it somewhere else. It will also supply to iliacus muscle in the iliac fossa. I'll make you draw a diagram for this one. Don't panic. Done. Now after completing all the muscles here, we are done only with motor supply. What about the sensory supply of the femoral nerve? Femoral nerve is also supplied to the skin also, the sensory supply. So let us write down all the sensory branches here. Number one, femoral nerve will have a sensory branch which is known as the saphenous nerve. Saphenous nerve. Saphenous nerve is actually a cutaneous branch. It is just supplying to the skin. Cutaneous branch of femoral nerve. Saphenous nerve. Now this saphenous nerve will be actually supplying to the skin on medial side of the leg and the foot. The skin on medial side of leg and foot up to great toe. That's important. Up to the great toe, guys. So saphenous nerve is supplied to the skin on the medial side of the leg and the foot up to great toe. To make you understand the meaning of this one, let me show you like one more beautiful picture here. Look at this diagram here, guys. Now in this diagram, this will be the leg over here and this will be the foot over here, and the skin on the medial side of the leg and the medial side of the foot up to the great toe. This all will be actually taken care by saphenous nerve. Saphenous nerve, which is in turn a branch of which one only? It's a branch of your femoral nerve. And try to recall the counterpart of that one. We have already discussed in our previous topic, guys. The skin on the lateral side of the leg and the lateral side of the foot will be taken care by which nerve only? That's your sural nerve. That is a sural nerve. And sural nerve is the one which is actually a branch of tibial nerve, sir. Tibial nerve, fine. So saphenous nerve is actually taking care of the skin on the medial side of the leg and the medial side of the foot. Now one important thing I would like you to appreciate here, that femoral nerve is actually supplying the muscles in which compartment, guys? It is supplying the muscles in anterior compartment of the thigh. So just imagine in your mind, thigh, anterior compartment of the thigh, femoral nerve is supplying to that sartorius and quadriceps femoris, blah blah, all that muscles over there. And right from there in the thigh, the femoral nerve is giving a saphenous branch, saphenous nerve, and saphenous nerve is crossing your entire thigh, then the entire leg, and then it is supplying to the skin on the medial side of the leg, medial side of the foot up to the great toe. So starting from the thigh, then leg, then foot up to the great toe. That itself indicates that it is the longest cutaneous nerve in our entire body. Okay. So therefore, I would request you to even make a note of that one. Saphenous nerve is actually a cutaneous branch, and that too, it is the longest cutaneous branch in our entire body. Saphenous nerve, which is a branch of femoral nerve. Now after that, let us see like one more like other sensory branches here. Number 2, other cutaneous branches of femoral nerve, guys. Number 2, femoral nerve will also give medial cutaneous nerve of thigh, and not only medial cutaneous nerve. Number 3, it will also give the intermediate cutaneous nerve of the thigh. Femoral nerve will give rise to few more cutaneous branches, which includes your medial cutaneous nerve of the thigh and then the intermediate cutaneous nerve of the thigh. And here there is one important clinical application. So let me discuss that simultaneously. Guys, the name itself is indicating medial cutaneous nerve of the thigh. It is supplying to the skin on the medial side of the thigh. And then intermediate cutaneous nerve of the thigh, it is supplying to the skin on the intermediate part of the thigh. Now automatically the question comes in our mind, sir, if it is giving medial as well as intermediate, then what about the lateral cutaneous nerve of the thigh? That's coming from where? And what is the clinical application of that? Let's see right now, sir. So imagine this one here to be the anterior superior iliac spine, and this one here to be the pubic tubercle and symphysis. Pubic tubercle and symphysis here. So this is your pubic tubercle here. Between the anterior superior iliac spine and the pubic tubercle, there will be a ligament, and this ligament here will be the inguinal ligament. Inguinal ligament. And just imagine your thigh over here, sir. So the pubic tubercle and the anterior superior iliac spine, between them we are having a ligament, that is a very famous one, inguinal ligament, and then the thigh part here. And now, my dear friends, remember the femoral nerve. Femoral nerve will give rise to only two branches here. One is medial cutaneous nerve of the thigh, and then one more will be the intermediate. I am just writing here as medial cutaneous nerve of the thigh, M here, and the intermediate cutaneous nerve of the thigh, I here, guys. Then automatically the question comes in our mind, sir, what about the lateral cutaneous nerve of the thigh? It's a branch of which one? The first important thing to keep in your mind, it is not a branch of femoral nerve. I repeat again, lateral cutaneous nerve of the thigh is not a branch of the femoral nerve. Then it's coming from where? From the lumbar plexus. From the lumbar plexus, L2 and L3. From L2 and L3, we'll be getting the lateral cutaneous nerve of the thigh. And sometimes what is going to happen, it is going beneath the inguinal ligament. That's the lateral cutaneous nerve of thigh. So one point to learn here, is it a branch of the femoral nerve? No, it is not a branch of the femoral nerve. Second point, then it is, if it is not a branch of femoral nerve, then it is coming from where? From L2 and L3. Sir, in our starting diagram, that is lumbosacral plexus, I did not make you draw this diagram. Why? Because this is actually the minor nerves. And in our starting first diagram, in the lower limb topic, that is lumbosacral plexus, I made you draw only the diagram of major nerves. So remember, lateral cutaneous nerve is a branch coming from L2 and L3. One more MCQ done. Now, it is usually going above the inguinal ligament, but in some people, some unfortunate people, it is going beneath the inguinal ligament, and there are chances of getting compressed. It will be compressed there. And if that nerve is getting compressed, what is this condition known as? This is the condition which is known as meralgia parasitica. So, what is meralgia parasitica? What is meralgia parasitica, guys? It is nothing but the compression of lateral cutaneous nerve of the thigh beneath the inguinal ligament. So, if that is compressed beneath the inguinal ligament, it is nothing but meralgia parasitica. So, that is important here. So, that is one important clinical application that we can remember easily when you learn about the femoral nerve and its cutaneous supply. Perfectly done. Now, after completing this one important clinical application here, let me teach you like one more clinical application of the femoral nerve here, guys. And for that, we need to draw the diagram again, and that to a big, neat and clear diagram. Now, imagine this one here to be the anterior superior iliac spine, and this one here to be the pubic tubercle and symphysis here, and this will be the pubic tubercle on the other side. Now, there will be a ligament between these two, that is anterior superior iliac spine and the pubic tubercle. This ligament will be the inguinal ligament. And then imagine this one here to be your thigh here. Fine. Now remember one thing, guys, there will be a sheath here. This is actually referred to as your femoral sheath. And I hope you people have learned about the femoral sheath in detail. Inside the femoral sheath will be actually divided into like 3 compartments and all. And one important information here is that femoral nerve is not going to pass inside the femoral sheath. Femoral is not inside the femoral sheath. Femoral nerve is actually outside the femoral sheath. So you just imagine this one here to be the femoral nerve here, guys. So this will be the femoral nerve, and remember, femoral nerve is not at all going inside the femoral sheath, guys. It's outside. I hope you remember that very famous mnemonic VN, VAN, femoral vein, artery and nerve. So a nerve is actually outside the femoral sheath. And after coming in the thigh, it will be actually dividing into 2 divisions. One will be the anterior division and another one will be the posterior division. And we are going to learn about them later on. First, let me tell you the important thing regarding the trunk of that one, the femoral nerve. Now, this femoral nerve, remember, in the iliac fossa, Here itself, it will be actually supplying to a muscle, and that muscle will be iliacus muscle. Iliacus muscle. A hip bone will have like three parts: the ilium, ischium, and the pubis. Upper expanded part will be ilium, and in that iliac fossa, there will be a muscle, and that muscle is iliacus muscle. And iliacus muscle is the one supplied by femoral nerve only, but keep in mind, it is not in the thigh, it is actually in the iliac fossa. Then femoral nerve will give like one more branch, and that one more branch coming from the iliac fossa only, and then going behind the sheath, behind that femoral sheath, and it will be coming in the thigh, and it will be supplying to a muscle. That muscle will be pectineus muscle. Pectineus muscle. So the branch for the pectineus muscle is given in the iliac fossa only, but it is coming behind the sheath and then supplying to the pectineus muscle, not the complete, only the lateral half of pectineus is supplied by femoral nerve. Perfect. These two muscles are done. And now comes the most important point, or the most important part, from where many questions are going to come, guys. First of all, femoral nerve is actually divided to two divisions here. So imagine this one here to be the anterior division, and this here to be the posterior division. And there is one MCQ which has been asked here itself, guys. What is the criteria for dividing the femoral nerve into the anterior and posterior division? What is the structure which is dividing that into two divisions here? So remember, here you'll be actually having an artery, and the name of this artery is lateral circumflex femoral artery. Lateral circumflex femoral artery is the one based on which the femoral nerve is divided to anterior division and the posterior division. So that is our important MCQ over here. After that, we know that femoral nerve is the one supplying to all the muscles in which compartment? Anterior compartment of the thigh. And what are the muscles that you have over there? Sartorius and quadriceps femoris. Now, important thing to remember here, which division will be supplying to which muscle. So, welcome here, guys. Out of these two divisions, anterior division is the one which will be supplying to sartorius muscle. So the longest muscle in our body, sartorius, will be supplied by anterior division of the femoral nerve. And after that, the anterior division will be actually giving rise to the two cutaneous branches, which I already made you learn. One will be the medial cutaneous nerve of thigh, and another one will be the intermediate cutaneous nerve of the thigh. Intermediate cutaneous nerve of the thigh. So, but remember, those two are actually the cutaneous branches, guys, the sensory branches. So femoral nerve is actually dividing into anterior division and the posterior division. Anterior division is the one which is supplying to one muscle, sartorius muscle, and along with that, the two cutaneous branches, medial and intermediate cutaneous nerve of thigh. Done. That completes the story of anterior division. Now let us learn about the posterior division. Obviously, posterior division is the one which is taking care of the quadriceps femoris muscle. And what are the four heads of the quadriceps femoris muscle, guys? Number one, it will be supplying to rectus femoris. Number two, the vastus lateralis, and then in the middle of that, vastus intermedius, and then we have got the vastus medialis. So all these are the four heads of quadriceps femoris muscle. So which division is supplying to that one? That is your posterior division. That's important. So I think this is like the best way of learning, guys. Don't try to jump as usual. If you have like watched all my anatomy videos and all, I'm always like never like jump to the entire topic at once. So try to go it like slowly, one by one, baby steps. So in the very beginning, I made you write down like a list: sartorius, quadriceps femoris, pectineus, and iliacus. And now we are going like in depth, exactly like which division, whether it is anterior or posterior, everything in depth. So that is the best way of learning instead of just jumping to the entire topic at once. Don't do that. Learn in this manner. Now the last and final thing, after supplying to all this, it will continue down and give a cutaneous branch, which is the largest cutaneous branch or the longest cutaneous branch in our body. That is your saphenous nerve. Saphenous nerve here, guys, and you all know very well saphenous nerve, already we have written there. It is the one which will be supplying to skin on medial side of leg and foot. Up to where? Up to the great toe. So saphenous nerve is the one which will be supplying to the skin on the medial side of the leg and the foot. Up to where, sir? Up to the great toe. So that completes your entire femoral nerve. and all the branches of femoral nerve, its division, everything is done in a crystal clear manner. Perfectly done. Now, one more thing that I want you to understand here, one important applied aspect is that nerve which is actually supplying to rectus femoris muscle, the nerve which is actually supplying to rectus femoris muscle, it will also give a branch, and that branch will be supplying to a joint there. That joint will be your hip joint. So let me just put it like this here. So this nerve to rectus femoris will also give a branch, and that branch is the one which will be supplying to hip joints. So hip joint is supplied by nerve to rectus femoris. That's important. Now try to correlate here. The nerve to rectus femoris is supplying to hip joint over here, and there itself we can see the entire nerve, that is the posterior division, will continue down, and it will continue down as your saphenous nerve, and that is the one supplying to skin on the medial side of the leg and the foot. Because of this connection over here, that's the reason why if there is a pain in the hip joint, that will be referred to the medial side of the leg and the foot. The pain in the hip joint is referred to the medial side of the leg and the foot. And already this question has been asked in the exam. The pain from the hip joint will be referred to medial side of leg and the foot via which nerve? What is the nerve responsible for this one? The answer is on the screen there. It's your femoral nerve. Femoral nerve is the one which is responsible for this referred pain. So let's just make a note of this one here, guys. The pain from hip joint is referred to medial side of leg and foot. Yes, and that is cause of which nerve, guys? The answer here will be your femoral nerve. So that is one important clinical aspect that I wanted to let you know from our diagram there, guys. Crystal clear. So then, like, not only this applied aspect over here, sir, not only that, like there's so many MCQs which we have covered, already asked in the exam. Anterior division supplying to which muscle? The only muscle supplied, sartorius. Posterior division is supplying to which muscle? That is supplying to quadriceps femoris. The anterior and posterior divisions are divided based on which artery? Lateral circumflex femoral artery. And the trunk is the one which is supplying to two muscles, iliacus muscle and pectineus muscle, only the lateral half. Then finally about the referred pain. So almost like every MCQ regarding the femoral nerve has been completed here. So we're done with the motor supply, we're done with the sensory supply, all the branches, and along with all the applied aspect here. And that completes your entire femoral nerve over here, guys.